There are several things that can affect the safety or quality of a final blood product, making it either unsafe for transfusion or unacceptable for customers. Some of the usual suspects that might compromise a product are heat, cold, mishandling, contaminants, packaging or labeling defects, or donor illness. All blood products at Versity must be carefully inspected at every turn, and each of us must be prepared to identify conditions such as hemolysis, red cell contamination, lipemia, or icterus, and to recognize particulate matter, discoloration, or any evidence of bacterial contamination. In this course, we will discuss these conditions and more, and learn how to conduct a thorough visual inspection of our blood products to make sure they are safe and suitable for use. During our journey, we will explore how to inspect the product itself, walk you through inspection of the product bag, introduce ISBT or Information Standard for Blood and Transplant labeling requirements, and show you how to detect unacceptable labels. We'll provide tips and tricks for troubleshooting issues and relay the requirements for documentation. Before we get into it, take a minute to consider the acronym RARE. We each have a responsibility to thoroughly inspect each unit. You are accountable, yes you, for making sure the products that pass through your hands are safe and suitable for use by the patient. And that patient is relying on you, putting their health and well-being in your hands. So understand when it comes to inspection of our products, at the other end of the line is a living, breathing human that needs this product. And it could quite literally mean the difference between life and death for that person. So we understand the importance of what we do and take our responsibility very seriously. We hope you will too. Let's start with the product label. There are various stages of labels. The first is applied by the bag manufacturer. After collection from a donor, the label will only have a donation identification number on the front, in the top left quadrant, and possibly extra DIN stickers on the back. During processing, there can be a number of 2x4 labels added to the unit, depending on how production goes. Each of these labels requires specific information. At final labeling, it gets a 4x4 label with all the required ISBT information, what we often call the ABO label. A product must have the final ABO label before it can be sent to hospital services and distributed to customers. Hover over the labels to view a few examples. The information found on the final ABO label is regulated under the Code of Federal Regulations, so it's very important that it be complete and correct. This label includes 4 quadrants of information: the DIN or unit number, product code, blood type and RH factor, and an expiration date. Labeling requirements are standardized, and all 4 quadrants must be complete and readable to be considered a good label. Let's take a closer look. Take a moment to familiarize yourself with the various components of a final ABO label. Hover over the label to explore. Once you've viewed each section, click Next to continue. There are several things we want to look for when inspecting a product label. Use the arrows to navigate through the examples. You always want to make sure that the label matches the blood component or product. For instance, if it says red blood cells but looks like plasma, well, you know that is incorrect. The text should not run off the label on any side. The print must be complete and legible with no streaks or smudges, and the ink must be dark enough to read easily. The donation identification number should never be upside down or obscured, and it should always appear at the top left of the label. There should be no handwriting on the bag nor showing under the final label. All blanks must be filled with the appropriate information. The expiration date must be complete and appropriate. If it says 2004, for example, you know something was keyed incorrectly. Now let's take a look at some unacceptable labels and possible solutions. Click on any label to begin. Once you've viewed all the examples, click Next to continue. This label image is too light and not clearly readable. To fix this issue, try cleaning the print head or increasing the darkness setting on the printer. Alignment on this label is incorrect. The words expiration date and time do not fit on the label and are running off the right side. If the print is running off the right side of your label, you'll want to adjust the left position of the label printer to a lower number. The alignment on this label is incorrect. The product name and other attributes are partially missing on the left. If the print is running off the left side of the label, adjust the left position of the label printer to a higher number. Alignment on this label is incorrect. Only the bottom half of Indiana Blood Center is printed. If the print is running off the top of the label, adjust the top position of the label printer to a higher number. On this label, the product volume and anticoagulant have been left blank. To fix this issue, first review the base label for missing information, or obtain that information, then document the missing information on the label. Areas of this label are not legible, as evidenced by the huge gap you see here. This is unacceptable no matter where it appears on the label. So if you encounter this issue, inspect the printer ribbon for folds and adjust it as necessary. The check digit on this label is partially obscured by the final label. Remember that no part of the DIN label should be hidden. If it is, you'll want to check with a manager to determine if the 4x4 label or DIN needs to be removed and replaced. Here we see writing visible under the final label. If you see this, you'll need to return the product to CP to be relabeled. Before we move on, let's look at one more label issue: an incorrectly placed or skewed DIN label. If the DIN label is in the wrong place or skewed, wrinkled, folded, or something similar, you will need to obtain another matching DIN label and place it in the correct space to allow ABO labeling. You can get a matching DIN label in one of two ways. Extra DIN labels can often be found on the reverse side of the bag. They will have been placed there by the collection team. Or, if there are no extras on the reverse side, you can use the DIN replicator to print a matching DIN label. One very important side note: once a label is affixed to a product, it must stay on the product. An unlabeled unit, even for a moment, is unacceptable. So, bottom line, never ever peel off a DIN label to try to fix it or to move it to the correct location. Instead, always obtain and place a matching DIN in the correct space. Now that you know what to look for in a product label, let's talk about inspecting the product bag. The product bag, regardless of the type of product, should not have any stray ink or pen marks on the plastic, cracks, leaks, or signs of puncture, blood component in the ports or sealing sites. It should not have any broken or exposed ports, air in the tubing, broken tubing, foreign objects, or girdling of the segments. Click the question marks to see a few examples. In addition to inspecting the bag for issues or defects, we need to also take a close look at the product itself. Let's start by establishing a baseline of what is normal for each component. Both whole blood and red blood cells are opaque, meaning you can't really see through it, and range in color anywhere from a bright red to a dark burgundy. After resting or centrifugation, they'll have an upper layer of plasma in varying shades of pale to dark yellow or slightly tan. The plasma separation should also be noticeable in the segments. Either product may have a thin white layer of blood cells and platelets between the red cell mass and the plasma, and they may, on occasion, contain a small amount of white particulate matter. Platelets are mostly clear to slightly opaque, should not be milky or cloudy, and you should be able to see the label through the platelets. Platelets typically range in color from pale to dark yellow or slightly tan, and may have a slight salmon or light orange tint. Although we can't see this without a microscope, platelet cells have a unique discoid shape. And so, when the resuspended platelets are gently swished around in front of or under a light source, the platelets produce a shimmering opalescence or swirling effect. Platelet components will normally contain varying amounts of small aggregates. Transfusible liquid plasma is mostly clear to slightly opaque. It should not be milky or cloudy, and you should be able to see the label through the plasma. It will range in color from pale to dark yellow or slightly tan, and it may have a slight salmon or light orange tint. There should be no visible precipitates or red blood cells in transfusible liquid plasma. Frozen plasma and cryoprecipitate are opaque when frozen. The color will range from different shades of yellow to slightly tan and may have a slight salmon or light orange tint. There should be no indication that the product has thawed and refrozen. Products that are frozen on a rack will have an indentation in the bag from where it rested on the rack while freezing. If it is partially thawed then refrozen, that indentation may disappear, appear to have moved, or there might be additional indentations. Products frozen using an Instacool will have a bubble at the top of the bag. If the bubble is not at the top but on the side or any other area of the bag, that would be evidence it has been thawed and refrozen. Early in this course, we discussed safety and quality and mentioned that each of us must be prepared to identify conditions such as these. So let's get into it and learn a little more about each. Hemolysis is the destruction or breaking down of red blood cells and can be identified by discoloration of the surrounding or supernatant plasma. We would typically detect hemolysis in red blood cells, though it can be present in platelets and plasma as well. Hemolysis can be caused by many different things. It can happen naturally as the unit ages, or be due to bacterial contamination or donor illness. It can also be caused by extreme temperatures during storage or transport, or from a heat sealer, ice, or ice packs, which is why it is important that we avoid direct contact of red blood cells with ice. Damage can also occur while centrifuging, stripping, mixing in additive solutions, filtering, or banding. So do not band too tightly. We want to keep them together, not prevent their escape. Hemolysis can range from partial to complete. A small amount of hemolysis is expected and acceptable. Excessive amounts are not. The unit pictured to the right appears to be hemolyzed. Note the lighter color in the plasma portion. This is described as supernatant color. Here's a graphic representation of increasing percentages of hemolysis in a unit of red blood cells. The first shows some hemolysis, the second more, and the third even more. We check the color of the plasma in the unit and in the segments to determine if hemolysis is present and to what degree. Hemolysis in whole blood or red blood cells caused by bacterial contamination will result in a dark purple to black discoloration. Hemolysis in supernatant plasma of whole blood or RBCs ranges from a light pink to bright cherry red or even darker. Hemolysis is possible in plasma or platelets as well, depending on the number of red cells present in the product. It will result in a translucent pink to red color and be opaque if it's frozen. Note that plasma separates as a unit settles. If it has been jostled around too much, the presence of red cells in the supernatant might be mistaken for hemolysis. So it is always best to inspect segments before moving the unit. The color of the segments should closely match what you see in the bag. Also, check the banding to make sure it's not too tight. If it is, it might have damaged the red blood cells. Then you'll inspect the plasma portion of the segments and use a color comparator to check acceptability. If the plasma portion is out of the acceptable range, set it aside and place a hold, as products with excessive hemolysis are not acceptable. Red cell contamination is the presence of an excessive number of red blood cells in a product from which they have been removed, like platelets, plasma, and cryo. As you might have guessed, red blood cell contamination does not apply to red blood cells or whole blood. The color of a red cell contaminated product can range from a light pink or salmon-colored tinge to dark orange or red, and in frozen products may appear as a streak of color. Excessive red cells in a product can be problematic and even dangerous for patients, so we need to ensure that our products always fall within our guidelines. All products should read within the acceptable range of a color comparator, which will ensure less than 2 milliliters of red cells in that product. And frozen components should have no visible streaks of color that are darker than allowed. Lipemia is the presence of lipid particles in the blood and may cause blood components to appear milky. It can range from slight to excessive and can be caused either by the donor having a high-fat meal before donation or from having a condition such as high cholesterol. Excessive lipemia in whole blood or red cells may appear as a layer of milky fluid or even cause it to look like a strawberry milkshake, depending on the severity. Excessive lipemia in platelets or plasma will cause the product to be opaque and milky, and the color can range from pink to yellow. Bottom line, whole blood or RBCs should not be milky or cloudy, and you should be able to see the label through plasma and platelets when they are in liquid form. If you cannot, then the lipemia is considered excessive. All excessive lipemic products should be rejected. Icterus is an excessive amount of bilirubin in plasma. It can be caused by one of several medical conditions and will cause plasma or platelets to appear bright neon yellow to brown. Discoloration such as this would deem a product unacceptable. Particulate matter consists of various blood elements, like red or white blood cells, platelets, coagulation factors, protein material, tissue plugs, or fatty substances that are formed in the routine process of collection, manufacturing, and storage. This can include clots, fibrin strands, aggregates, white particulate matter, flocculent material, or cold agglutinins. Some are concerning, and others are acceptable. Click on each to learn more. Clots are thick, opaque masses that do not disperse easily with gentle manipulation or with a change in temperature. In whole blood and red blood cells, clots are dark burgundy to dark purple, and in red cell segments, they may appear as a red or black stringy mass. In platelets and plasma, clots are whitish in color. Clots in any component are not acceptable. In any component, fibrin strands appear as thin, whitish, thread-like strands, possibly with fibrin clots, that do not disperse easily with gentle manipulation or with a change in temperature. Blood components containing fibrin strands or clots should be rejected. Aggregates are small, whitish masses that appear waxy or plaque-like and do not dissolve with gentle manipulation. Smaller aggregates may come together to form larger clumps or masses. Platelets with multiple small aggregates are acceptable. Platelets with excessive aggregates, or any the size of a quarter or larger, should be rejected. White particulate matter is small aggregates typically found in whole blood, red blood cells, or red blood cell segments, and in platelets. It can look like small white specks, small waxy globs, or a crystalline or fatty material. Products with small aggregates are acceptable. Products with excessive aggregates or clumps are not. Flocculent material is a fluffy or cloudy white precipitate found in liquid plasma that may look a little like tissue paper and disperses easily with gentle manipulation. This sometimes forms when plasma components are frozen and then thawed. Transfusible plasma should have no visible precipitates. Agglutination or clumping of red blood cells can occur when a certain antibody is present in the blood. Cold agglutinin may cause a whole blood or red cell unit to appear clotted. At refrigerated temperatures, the component will move in the bag as one large clump, and as it starts to warm, may appear granular, like coffee grounds. Products with this condition are not acceptable. Discoloration refers to any unusual color in a blood component. We would typically look for discoloration in the plasma portion of a component where it's most noticeable. Odd colors can be caused by several things, some harmless and some quite concerning. For example, medications like oral contraceptives may result in a pale green color, and vitamins may result in a bright neon yellow or orange. Discoloration can be due to some of the conditions we discussed, like hemolysis, or lipemia, icterus, or some other metabolic condition. Or it could be caused by bacterial contamination, which we'll talk about next. The most important thing to remember is what a component should look like. The normal range for our platelets, plasma, and cryo products is a pale to dark yellow and or slightly tan. Normal for whole blood or RBCs is a bright red to a burgundy color. Any product outside of the acceptable range should be set aside. Bacterial contamination is the presence and growth of bacteria in a blood component. Human blood does not typically contain bacteria, and our processing is designed to inhibit the potential of bacterial contamination. However, it can be caused by bacteria present in the donor's blood or on their skin, or collection instruments or products that are not sterile, which could be due to a manufacturer defect or something else. Many of the things we've already discussed can be signs of bacterial contamination, like unusual color in the product or supernatant plasma, for example, purple or black in whole blood or red cells, or a color that is darker than the segments, or a grayish color in platelets, murkiness or cloudiness of a product, clots or fibrin strands, and also unusual and excessive air bubbles. Any of these factors would make a product unacceptable. Let's put it all together. When you conduct a visual inspection, you'll be checking all the things: the bag, the label, and the product. Bottom line, no product should be a funky color. Funky being anything outside the normal and acceptable range on your color comparative and what we've described in this course. There should be no red cell contamination in plasma, platelets, or cryo components. Blood components should have no clumps, clots, or fibrin strands. Some small aggregates in whole blood and red cell components and in platelets are expected and acceptable, but large aggregates that do not disperse when gently manipulated are not. There should be no evidence of thawing and refreezing in our frozen components. There should be no cracks, tears, or defects of any kind in our bags or in our tubing. Foreign objects are never okay. There should be no excessive bubbles or cloudiness or other indications of bacterial contamination in any component, ever. And the label must be complete, legible, and correct, meeting all the requirements we've discussed in this training. Click on each component to view a visual inspection by one of our team members. When you have viewed them all, click Next to continue.
So I'm inspecting a leukoreduced red cell. First, I'm going to make sure that I have a unit ID, that I have blood center information listed below, and RX only information listed below. I'm going to make sure that I have a product code, and if there is any volumes that need to be listed, that they're listed below the product code. That I have an ABO code, and I have an expiration date. I also need to make sure that each of the barcodes is scannable, that there's no lines or slashes through. I'm going to make sure that the label is clear and not cut off. And I'm going to make sure that the unit IDs on the front match the unit IDs on the back. From there, I'm also going to look for excessive hemolysis. I'm going to look for lipemia or cloudiness. I don't want my color of blood to be brown, purple, or murky. I'm making sure that I have no leaks or punctures in the bag and that my ports are intact. I'm also going to make sure that I have 5 segments and that the segments are not lighter than the blood that's in the bag. I'm also going to make sure that there are no clots. I am inspecting leukoreduced platelets right now. So I have a Sorlin treated platelet and I have a leukoreduced bacterial monitoring 7-day platelet. For both of these products, I'm looking for a unit ID. I'm looking for blood center information, RX only, a product code. I also want to make sure that any volumes are printed down below, as well as any platelet count information has to be listed on the product. So for here, you can see that it's up top, and for here, it's down below. I'm making sure that I have an ABO code, a barcode for my expiration date, and then on this product, I do happen to have a CNV negative barcode as well. I'm also going to make sure that the unit IDs on the product match what's on my tags here. And then I'm going to turn them over. And in terms of color, I am looking for no excessive lipemia. They should not be purple, brown, or cloudy. I want to make sure that I don't have any fibrin clots that I can see. I want to make sure that I also don't have any excessive lipemia. I'm also going to make sure that I don't have any red cell contamination as well. I'm looking at my ports, making sure that everything looks good. And then I'm also going to hold it up to a light just so I can see the presence of swirl and any aggregates that might be in the cup. Okay, so this is a frozen plasma. I am looking to ensure that it has a unit ID, blood center information, RX information, that there's a product code, and that any volumes that need to be documented are documented down below. I'm ensuring that I have an ABO code and an expiration date, and that all 4 barcodes are scannable, and that the label is clear and concise and nothing is cut off. I am also checking to ensure that there are no cracks or breakage in the ports or anywhere along the sides of the bag. I am looking for evidence of thawing or refreezing. I am ensuring that there is no excessive lipemia or milky texture, that the color is not purple, brown, or cloudy, that there are no excessive aggregates or fibrin clots, and that there is no excessive red cell contamination. I am inspecting a pooled cryo product. I'm ensuring that I have a unit ID, blood center information, RX only information, and I have a product code. Any volumes or number of pools should be documented down below. I'm ensuring that I have a ABO code and an expiration date, and that all of my barcodes are scannable, that my label is not cut off and is clear and concise to read. From here, I'm going to take a look to make sure that there are no cracks in the bags or along the ports here. I'm making sure that there's no evidence of thawing or refreezing, no excessive lipemia, that the color is not purple, brown, or cloudy, that there's no excessive aggregates or fibrin clots, and that there's no excessive red blood cell contamination.
Products may be set aside to settle and be inspected later. Just make sure to add a component note in the unit queue to explain. You'll place the unit in a labeled tray in the non-quarantine refrigerator and wait at least 15 minutes before going back to check and see if there's a clear separation between the blood and plasma. If there is clear separation, you may proceed to pack the product or place it back into general inventory. If there's not clear separation due to hemolysis, the product may be rejected for unacceptable appearance per the SOP. If the product settlement is unclear and a judgment call cannot be made without assistance of management, then you will quarantine the product and add a note in Unit Q and wait for management to review. Take a moment to study the protocol before moving forward. Any product that does not meet inspection criteria must be electronically and physically quarantined. You will apply a hold in the appropriate hold screen, add a component note, and then place the quarantined product in the temperature-monitored departmental quarantine location for review by management. Take a moment to study the protocol before moving forward.